We are working our way down the body here to the wrist, a very complex joint line. Elbow joint, that's the origin of the ulnar and the radial bone. Well, those two bones end and they are just before the carpal bones of the wrist. And there are 7 bones there that are subtle little movers held together by a series of ligaments. So you've got your carpal bones, which allow the hand to move inward and outward, up, down, and to circumduct, to make rounded motions. That's called circumduction. So it's quite a complex joint line. There's some major things, or I should say common things that go wrong with wrists, so we're going to stay focused on that. One of them would be, of course, the famous carpal tunnel syndrome. And that would be if you had repeated injury to the space just above the carpal bones, you could start to slowly grow bone into the carpal canal, thereby affecting the median nerve, which is coming down the inside of your arm and forming the connections for your thumb and your forefinger and the middle finger on the palm side. And that carpal tunnel has got a little retinaculum over it as well, which sometimes can also adaptively change over time due to sports and exercise habits, things like that. Maybe some chronic work-related ergonomic issues over time, like mousing and typing for long periods of time. But you got the retinaculum over the top of those carpals. The carpals, again, are complex. You'll see in the photos here how many there are. The main ones you want to really understand are going to be the scaphoid bone, because of the way it glides in the cup of the radial bone at the end here. So the scaphoid allows that type of motion. So the hand would come in about 15 degrees, and the hand would go out about 30 degrees. The hand should be able to extend 90 and flex 90. Those are the normal ranges of motion. Christine has a normal healthy wrist here, so her hand achieves all of those range of motion goals. And you've got de Quervain's tenosynovitis, which is a condition where you might feel pain on the back side of your thumb when you use it. There are tendinous sheaths that run across the top of the thumb, the back side here. So the musculature that is found over here in the forearm contracts. The tendon pulls through these synovial sheaths, as you'll see in those pictures, and takes the hand and the thumb and pulls it back. On the opposite side, we have a very common condition, Dupuytren's contracture. Generally, you'd find it in the palm of the 4th digit. It could be found elsewhere, but you'll see that the skin segments are starting to become puckered as there's lesions, and these are idiopathic. We don't quite understand. I think I've seen quite often people getting them from overuse, like picking up golf at a later age, over-gripping golf clubs, over-gripping tennis rackets, over-gripping things, and over time you're just going to start to see a lesion form in the hand called trigger finger, or more precisely Dupuytren's contracture, and that's something that can be treated as well. Of the major things that go on with wrists and hands, you're going to have degenerative changes. The thumb, you'll find in a lot of women. So Christine's thumb actually has normal range of motion. It's slightly hypermobile, and that if I drew a line right here and I'd follow it along, it goes slightly past straight. Some of you will notice that your thumb goes way past straight here on this particular assessment, which means you have hypermobility. The ligament that's holding this phalanx here from the metacarpal is very lax, just sometimes due to birth, sometimes due to an old injury. And when you go to do something like grip, the thumb kind of folds back. And so that can become problematic in that you can start getting arthritic changes here at the base of your thumb. Not to mention one of the carpal bones that's at the base here, the trapezoid, can also become degenerative. It sits just above that scaphoid bone we talked about earlier, and that can be degenerative as well. So if you're having chronic problems here, you might get a set of x-rays, take a look at the hand, and rule out at least some of the degenerative changes that are quite common to the thumb side. Others, you'll see the old Heberden nodes, which would be arthritic patterns noticed here at the distal fingertips. You'll see that the end joint line starts to become fat and misshapen, and that would be sometimes due to genetics, sometimes due to habits, where you're using your hands in a funky way for a while that begin to start to form arthritic changes here. So those are the major features of hands that you need to know about.